So Dr. Schwag, can you tell me a little bit about what happens when it's time for the patient to meet with you virtually?
Yeah, so again, um, as I mentioned, our workflows were very, very similar pre-coronavirus when we were doing a hybrid of in-person, phone, video, even some e-consults where a message comes in. We try to answer most of our portal messages without an additional charge, particularly when it's just a follow-up or a side effect. But if it's something new that comes in, we frequently will bill that. So the workflow is very similar for any of those use cases, really. Basically, when I go to work for the day, I have my schedule in front of me. There's a list of patients. And pre-coronavirus, it could be a mix. I would go to my physical office, and I could have a mix of in-person, video, phone. There would be days when I was dedicated only virtual, and I would work from my home office. So we're mixing things up that way as well. But basically, I have my work list in the EMR. I open up a patient, start taking my notes, input all the normal things I would on a doctor visit, subjective, objective assessment and plan. For the objective section, I always try to document something. Obviously, if it's in person, I could do a physical exam, but if it's a phone or video visit, on a phone visit, you can document, how clear they were speaking, what their cognitive functions seem to be, if they were a good historian, et cetera. On a video visit, you can document more, right? You can talk about, sometimes I'll look at different physical findings, skin exams, et cetera. If they tell me they have abdominal pain, I'll have them, move the camera or stand up so I can see their belly and tell them to push where the pain is or point to where the pain is. I can do it like a tongue exam, kind of get a little view of from a TCM perspective, what's happening there. So I'll document all that, and then complete the note, put in my assessment, put in my plan, tell them the notes of everything I want them to do, add the diagnoses, add any supplements or tests, test kits, LabCorp Quest recommendations, etc. And then in our build of Serba, we have a little box when I'm done. I check the little box and it says, tell admin that the note is ready to process. And that basically sends a note over to my admin queue, and they know to go ahead and pick up that note and process it. And from there, they basically take the plan section, immediately send it to the patient. So there's no waiting, they get the notes right away. And then we generate lab slips within the EMR, make those viewable to the patient or fax them directly in. And if there's anything that has a cost to it, for like a supplement or a functional medicine test kit or any kind of other testing I might order, home pulse oxygen measuring or anything else that has a cost to it, we add that to an estimate. And then the patient gets sent an estimate. They are notified, please go and review this estimate and either approve it or tell us, which parts you want to go with and which parts you want to wait on. And then once they send that information back to the staff, our staff goes through billing it, charging it, and shipping everything, and drop shipping. We don't, again, on the virtual side, we actually don't hold inventory in anything for the most part. We drop ship supplements, we drop ship lab kits from the vendors. There's a small amount of things that one of our staff people keeps in her home closet of her home office and sends out as needed, things that can't be drop shipped. But it's a really pretty marked minority of everything that we're sending. So a little bit unique to our practice compared to practices I've worked in the past, and also some integrative or functional practices. We don't have a supplement dispensary on site. And so, it's not perfect. Sometimes we wish I could just kind of send people out the door with those kits or supplements, but the trade-off on my end and on our end for the practice has overall been a win.